I want to ask you a question as a lady. Have you ever taken antibiotics at any point in your life for an infection and suddenly your menses or your menstrual flow refused to show up? Have you experienced that before? Maybe you took an antibiotic like amoxicillin, azithromycin, or doxycycline, or flagyl, or even any other antibiotic, and your period became late or refused to show up. And maybe you are thinking, is this antibiotic that stopped my period? Immediately I finished this antibiotic, I have not seen my period since I took this antibiotic. Or maybe someone told you that antibiotics, can delay your period or can stop your period. In any of the cases, that is why I'm here to bring clarity. Is it actually true that antibiotic can stop your period from coming or from showing up, or can delay it from showing up? As a pharmacist, that is why I'm here to explain in a simple language. So if you have such questions, or maybe your friend is going through something like that, and she is, thinking that, oh, maybe it's the antibiotics I took that is delaying my period, watch this video to the end, because I will be bringing simple, clear explanation to this as a pharmacist. And if you can watch this video to the end, you will also learn or know what to do if your period becomes late, maybe after you have taken antibiotics or maybe any other drug, as the case may be. So I welcome you back to this channel. As you know, my name is Pharmacist Ezekiel Ozumba, a licensed pharmacist currently practicing in Nigeria, and I want to implore you to subscribe to this channel. This is a channel I created to create health and medicine related information that will be of help to you, and I know you will not want to miss any of my videos, so put on a notification button and share. Also like, comment, or ask your questions in the comment, and I will attend to them, and I will also respond accordingly. Let's go straight into the video so that I will bring you the simple, clear explanation on the question on ground, which is, can antibiotic actually stop your menses from coming out or from showing up, or can antibiotic delay it from coming out? Actually, the short answer is that most antibiotics does not directly delay your period or stop it from coming out. Yes, you heard me correctly. Taking an ordinary antibiotic does not mean that your menses or your menstrual cycle or your period will come late or will be delayed. But there are some important things you need to understand. Come to think of it, why do people think that antibiotics delay periods or your menses or your menstrual cycle? Why do people think that antibiotics can delay period or menstrual cycle? Let's say a woman develops an infection and she goes to a lab by the recommendation of the doctor or a pharmacist, and the test is being conducted, and in the lab result it was discovered that there is a staph or E. coli or any other bacterial infection, and she comes to the pharmacist, and working with the test result, the most sensitive drug or medication or antibiotic is recommended for her to go and take so that the infection can be taken care of. Coincidentally, her expected period delays or doesn't come or doesn't show up. Naturally, she may think, and this antibiotic caused this delay, and this antibiotic make me I never see my period, or something like that, or something of sorts. But sometimes the antibiotics may be receiving blame for something else. For example, the infection itself can put stress on the body. Yes, infection stresses the body. If you don't know it today. So when your body is dealing with an illness or it's fighting an infection, your normal menstrual flow may be delayed or may not come exactly as when due. This is because stress can also affect your menstrual cycle. Confirmed. And aside that, there are also other reasons why menstrual cycles can be delayed or can come late. One of such scenario is pregnancy. You may be pregnant and you are not aware, and you will be blaming the innocent antibiotics for stopping your menstrual cycle from coming as when due. Changes in weight, excessive exercise, hormonal contraception, PCOS, that's polycystic ovarian syndrome, and thyroid problems can also affect your menstrual cycle. So please don't automatically blame your antibiotics. So Do antibiotics have nothing to do with periods? Do they have any connection with menstrual cycle? Do they have a way of stopping or delaying your menses? Now, this is where we need to be very careful. Most commonly used antibiotics, like I've said before, are not known to directly stop ovulation or deliberately delay menstruation. For example, like I've mentioned, antibiotics like amoxicillin, doxycycline, or any other commonly prescribed antibiotic, they generally don't interfere with hormonal contraception in the exact way people think or people has summarized it to be. However, there is an important exception. Rifampicin and rifabutin. These antibiotics can interact with hormonal contraceptives and reduce their overall effectiveness. So this information is very important for those who use birth control pills or contraceptives or contraceptive tablets. So if you're using hormonal contraception and you are prescribed rifampicin or rifabutin, please don't assume that all is well. Ensure you inform your doctor or your pharmacist the contraception method you are using. You may be asking, pharmacist, I took amoxicillin and this very month my period has not shown up. It has delayed with 7 days or with 2 weeks as the case may be. And you may be asking, is amoxicillin responsible for this? Like I said, and I reiterate, amoxicillin is not considered a direct cause for your delayed period or your delayed menstruation. You have to look at the bigger picture. Were you sick? Were you under a lot of stress even while you're on the antibiotics? Did your eating pattern change? These are some of the questions you need to be asking yourself. Did you lose or gain a significant amount of weight? Or are you using hormonal contraception? Is there any possibility that you are pregnant? These are questions you should consider asking yourself than just concluding that now amoxicillin cause amo. No, that's not true. You may be asking again, pharmacist, what about metronidazole flagyl? I also took it and it seems as if my period was delayed. What about flagyl? Again, metronidazole or flagyl is not considered to have any direct connection to your menstrual delay in the flow of your menses. So if you are taking flagyl and you notice a delay in your menstrual flow, don't just conclude that, now this flagyl cause am. Like I've already listed. Consider asking yourself certain questions, and with the help of your pharmacist or your doctor, a likely possible reason will be found, and the right solution or treatment will be recommended to you or for you. I want to sound a note of warning. As a lady, your body is specially constructed and made. It's not every antibiotic, it's not every drug that your friend recommends to you that you begin to take or you start taking. No. Ensure that you have a proper consultation with your pharmacist or doctor before taking any drug, because the truth is some drugs may not work for you as it worked for your friend. And that is why proper diagnosis should go on in the background before any prescription or any drug recommendation is made. Or you may also be asking, what if my period is late after taking antibiotics, What if my period is late after antibiotics? What should I do? Now, this is the most important part. If your period is late, maybe after taking some antibiotics, ask yourself these questions. Number one, could I be pregnant? So a simple pregnancy test can answer this question. Number two, was I recently sick? This is very important. Number four, have I been under unnecessary stress or unusual stress? Maybe because as a result of your work, maybe as a result of your marriage or your children, and maybe any other thing that can cause unnecessary stress to you. And number four question to ask is, am I using hormonal contraception? Are you taking contraceptive pills? Because they can also affect your menstrual flow. Number five, check whether you have gained weight or lose weight recently, and maybe a certain amount of weight within a short period of time. These 5 questions can go a long way to ascertain the cause of your menstrual delay. I need to sound a very important notice here. Please don't stop your antibiotics because you notice that your menstrual cycle is not coming as when due or stopped or is fluctuating. Please don't stop your antibiotics and don't start looking for drug to force it out while you are still on the antibiotics. Please take note of this. Just have this at the back of your mind that a late menstrual cycle is not automatically a side effect of antibiotic. Now, when should you see a health professional if you discover that you are actually experiencing delay in your menses or in the flow in your menstrual cycle? You need to see a doctor if you discover that your menstrual cycle has been delayed unnecessarily for a longer period of time or is fluctuating. It comes today and it goes off, or is even coming out but is consistently coming out for more than the required number of days. So you need to see a medical doctor for a proper diagnosis, and proper treatment will be administered if necessary. And also you need to confirm whether you are pregnant, especially if you're not seeing your menses at all. So like I said in this, when I started this video, a simple pregnancy test can answer that question. See your medical professional to find out the actual cause before you conclude that it is the antibiotic that you are taking that is affecting your menses. There are some myths and facts that are in connection to this topic, which I believe I must have done justice to them. But I will still bring it up so that you will answer it. You will answer it in the comment section for me. Number one myth is every antibiotic delays menstruation. True or false? Put it in the comment section. The second myth that people are promulgating or are spreading is that if my period is late after antibiotic, it simply means that the antibiotics damage my hormones. True or false? Put it in the comment section. The third myth is once I discover that my menstrual flow is not coming out, I will take another drug to force it out. True or false? Put it in the comment section. Before I leave you in this video, next time somebody tells you that antibiotic can delay period, don't just accept it blindly. The truth is more complicated. So most antibiotics do not directly delay menstruation, as I have mentioned. But being sick, stress, unusual weight gain, the use of hormonal contraception pills, pregnancy, and certain health conditions can affect your menstrual cycle. And remember the important exception, rifampicin and rifabutin. These antibiotics affect the effectiveness of your hormonal contraceptives. That is why you should always tell your doctor, your pharmacist, the drugs or the medicines you are on before he or she recommends any antibiotic for you. If this video has helped you, has clarified your doubt, give me a thumbs up. Like this video, share it, comment, and in case if you are still asking, pharmacist, why is my period delayed? Put it in the comment section. And I will also do my best to explain as much as I can. Till I come your way next time, stay strong, stay healthy, subscribe to this channel. Thank you.